this is Sarah with Waterfall Yoga Therapy, and today begins our chair yoga sequencing. We are going to be practicing some somatic therapeutic yoga practices from a chair over the next several weeks. So be sure to hit subscribe and to follow along for the new videos as they drop each week. So this is going to be a great practice for anyone who is wheelchair bound, who has maybe some random aches and pains from being in an office space and having to work from a seated position a lot of your day. Or this is just great for beginners who want to experience a practice that is a little more mindful and a little less intense. So today's practice is all about the low back, healing our lower back or decreasing pain in the lower back region. So when you're ready, I'd like you to take a comfortable seat, preferably in some sort of chair that has no arms, where you can move your arms around freely, and preferably with your feet touching the floor. So if you're in a chair that your feet don't quite touch the floor and they hover, I have this problem a lot because I am short, you can maybe put a couple of yoga blocks or a book up underneath your feet. So let's begin in this practice, just kind of leaning back. Maybe take a roll through your shoulders and allow your body to recline back against the back of your chair. Ideally, your butt is fully back into the seat, so it is also supported at the lower back. And your feet, again, are touching the ground with your heels underneath your knees and with your ankles and your legs uncrossed. Place your hands on your lap somewhere comfortably and begin to notice your shoulders moving back towards the back of the chair. So again, you can take another roll through your shoulders as if you were hooking the shoulder blades down over the back of your seat. Now as you relax back, let your head also draw back towards the wall behind you. And as you're in this position, focus on your breathing. Imagine that there's an invisible string grounding you through your sits bones and working its way all the way up your spine through the crown of your head. If it helps, you can place one hand on your abdomen and maybe even one hand on your chest. And feel your breath moving the belly. The belly expands outward as you breathe in and back in, deflating as you breathe out. You might also notice that there's movement in the ribs moving out towards your elbows. Expanding the ribs out to the right and the left as you breathe in. And then drawing back in towards the spine as you breathe out. And then lastly, notice your chest breathing. This should be the most minimal amount of movement, as you should be filling up your lungs from the bottom to the top. So you might feel your hand just slightly spread as you breathe in that last bit of breath in the chest. There should be no movement in the shoulders. They should be very still. Almost a sense of expansion across your collarbones. And then a sense of deflating the lungs from the bottom to the middle to the top as you breathe out. Sometimes just coming into our body like this will change the way we feel pain in our body. So notice the level of pain you're in now, maybe on a scale of 1 to 5. Take note of your pain, where it is, what level it is, 5 being the worst, and 1 being the least. In somatics, it's good to have the brain learn through contrast. So how do I feel before I practice, and how do I feel afterwards? Good. When you're ready, release your hands. We're going to continue breathing in that way, this 3-part breath, the belly, the ribs, and then the chest. But we're going to start moving a little bit. So at this point, you might want to scooch forward on your chair so that the knees again align with your heels at the bottom with your feet touching the floor, creating a 90-degree angle at the knees and at the hips. And then sitting up tall with your back away from the chair. We're going to start with simple arch and flattens or cat-cow type movement. So I'm going to turn to the side so you can see what's happening in my spine. As I breathe in, we're going to tilt the pelvis forward. This is called anterior tilt. And then as we breathe out, we're going to tuck the pelvis back or round the back towards the chair behind you. So you're slouching. And then you're tipping the pelvis forward like your belly and ribs and chest want to come forward. And then round back. So the movement starts at the pelvis. When I tip forward, my fingers, if I put my fingers right on my hip bones, they're getting kind of almost pinched by my thighs and my belly because I'm tipping forward. And then when I go backwards, now there's space between my ribs. Now I have all this space to put my hand here as I round to the back of the chair. So the movement starts in the pelvis and then it undulates through the rest of your spine. So it's kind of a rocking motion of your pelvis and your spine. Very soothing to the lower back. Now you might add a sigh as you breathe out and hear the sound of your breath as you breathe in through your nose. And ideally breathing in through the nose because we want to filter our air through the cilia and our nostrils, but we also get signals to our nervous system when we breathe through our nose that we're trying to relax, we're trying to calm the body, calm the pain. So if you're able to breathe in and out through your nose, this is ideal yogic breathing. Now, once you've done that a few times, you might add a little bit to that. So you can add your arms. Maybe you let your arms hang at your sides, and then you start to let the arms roll back and the chin lift as you tip your pelvis forward. So it's a really kind of a back bend. And then maybe you let your chin draw forward and your arms roll in so the backs of your hands touch your thighs. Breathing in, shoulders squeeze toward the spine as you arch. And breathing out, tucking the chin, rounding your entire spinal column as you let arm bones roll in. So in somatics, this is emulating what we call green light and red light reflex. So green light is when we are sticking the chest out, tipping the pelvis forward. So it's kind of like this forward, outward open through the front of the body. And then the opposite is what many of us are in throughout the day. It's kind of like this rounded, hunched over our phones, our computers, driving in our car. And this is a way of retraining the nervous system. Retraining these postural patterns we have throughout the day based on our experiences. So once you've done that, maybe you sit again and explore breathing by itself without movement. Notice how it feels. How's your spine feeling? How is the lower back feeling? Is something already changing? Something changing in your pain sensations? Now, other good movement for the lower back would be to do some sort of side bend. So if you're on a chair, you can hold on to the side of the chair or the back of the chair and start to bring one arm up and over. Now, of course, if you have any kind of shoulder things going on, it might be as simple as just side bending and letting your hand glide down the side of the chair. And I'm kind of holding on to the other side of the chair for support so I don't fall out. I'm also not rounding forward just yet. I'm staying just very gentle to the sides. And then you can coordinate breathing. So maybe it's breath in, and you feel the space in your ribs and in your armpit, and then breathe out. Breathe in and out. Now your pace might be faster, it might be slower. If you tend to rush things, you're very busy-minded, maybe you slow your movement down. Challenge yourself by slowing it down, feeling the movement each step at a time, feeling your body contract to one side, shortening, lengthening on the opposite, and then releasing. And notice how this is feeling in your hips, in your back, and the rest of the body that's connected to your lower back and pelvis. Now, once you've done that, you can explore some other options. So maybe we take it more into a flow where we can let the shoulder round forward and round backwards. So there's a little more rotation in the spine. So we'll stay on this side and just feel the body as you breathe. Breathing in, shoulder coming forward in front of your face, and then back and behind you. And you can look at it with your eyes, you can make sound. How does that feel? Maybe there's some shoulder stuff going on in addition to your lower back. Now, before you switch sides, pause in the middle and notice. And then do the same thing or something similar to the other side. In somatics, it's all about retraining the brain from the level of your nervous system. So what feels good to you? We are all in different bodies. We are all having different experiences. We all have different things going on in our body, structurally, mentally, emotionally. So as you play with movement and you play with sound and breathing, explore. There is no right or wrong. What feels good to you today? And then once you've done that on both sides, bring your body back to center. Take a few breaths and even close your eyes and just feel. Feel the body, what's happening in the body. How's pain changing? How's your breathing changing? Your stress? And something else that might feel good here too is exploring movement, more movement in the pelvis that is less lateral, but more spiraling. So you might start to rotate your hips in a circle. So I'm leaning my pelvis forward, leaning into my left hip, tucking my pelvis back, rounding my back, and then leaning into the right sits bone. So I'm distributing the weight from one side of the body to the back, to the other side of the body, and to the forward position. So from a side position, it looks like this. And then I'm just kind of feeling my breath and my body as I do it. So if I'm rushing, I can slow it down. If I want some variation, how does it feel to move more upper body, shoulders, even the head and neck? So maybe now it goes from circular to more three-dimensional, asymmetrical, all around. And I can explore some of the aches and pains in a way that feels mindful and embodied. And I can encourage breathing into the lower back in some of these positions. And once you've got some movement in there that's free-flowing, see what it feels like to go maybe into a forward fold. So you could fold over your legs and then explore rocking, sighing, folding up and down, maybe touching the body as you come up. And you can touch with a lot of pressure as you go down, kind of like a massage. Or you can touch really light. Maybe you try with just 1 or 2 fingers of touch. How does touch make your body feel? Still the focus of the low back, but maybe there is a lack of touch. We're not really exploring that part of ourselves now. How does it feel to explore with good pressure, deep pressure, versus a light touch, a tickly or tingly sensation? And you might even take the arms up over your head. Good morning stretch. And then a folding all the way down. Let's do that last one, rising back up if you're doing some forward folding. And once you come back upright, slide back into your chair again. Roll your shoulders so that they hook onto the back of your chair. Rest your hands comfortably in your lap or touching your body. And come back into your breathing, noticing how you feel. Notice your breathing. And you might feel your pulse, your heart rate might have increased a little bit. You might feel tingly sensations or the sense of blood flow and vitality to various parts of your body. You might notice breathing has changed or your mood has shifted. But also become aware of your pain on your scale of 1 to 5, checking in again, 5 being the worst, 1 being the least amount of pain. Where are you on that pain scale now? What has shifted for you in your pain sensation? And acknowledge whether or not this practice has benefited you. And hopefully you've felt some changes in the positive and that you'll return again next week for our next YouTube video. Don't forget to hit subscribe.